What's up, family? How y'all doing? This is Cassie, and today we're going to be doing a somatically focused workout or session with the hips. Because it's a somatic session, I would like to take a moment and just to notice. You can sit with your eyes closed or open, with your gaze softened, whatever feels comfortable to you. In a seated or lying position, allow yourself to notice what you feel. Notice what's present in your body. Areas of tightness, tension, or discomfort. Areas of the body that might feel good and long and relaxed. And also those areas and spaces in the body that feel somewhere in between or that might feel nothing at all. When you're ready, taking time now to notice how you're feeling mentally and emotionally. Thoughts and feelings lingering on your mind and in your heart, whatever they might be. Excitement, anxiety, joy, sorrow, rage. Whatever is present for you, whatever is lingering under the surface. Taking a moment to acknowledge whatever you find, whether it be positive or negative. Allowing yourself to hold it closely and compassionately. And when you're ready, allowing yourself to gently let it go. This release is not a bypassing or an invalidation, but rather a momentary release, allowing you to be fully present in your body, with your breath, in this moment, right now. And then simply noticing what's present in this moment. Again, your eyes can be closed, softened, or open. Notice what's around you. Not only your body and how you're feeling, but the chair, the floor, the bed supporting you, your clothing and the air on your skin, the sound of my voice or music or things in the household or outside. If your eyes are open, noticing what you see and looking around you, becoming fully immersed in this moment in your surroundings. Noticing what is happening right now. And perhaps you take a moment just to notice how you feel, observing the now. Observing what's happening, what's present, what you're observing in this moment. We're often caught up in observing what's happened in the past or worried about what might happen in the future. And right now, this is all we need be concerned with. Whenever you're ready, you can open your eyes if they were closed or softened. And we're going to find a seated position. Again, you can be on the floor, on a mat, or even on a bed, finding somewhere comfortable for you to lie. And the first thing I'm going to ask you to do is to press into your heels, lifting the hips up any amount, and then slowly, one vertebrae at a time, lowering the back down to the floor or bed, allowing yourself to find a little bit of extra space in the lower spine. And perhaps you take a moment to notice how good that feels. And when you're ready, we're going to lift the right leg straight. Taking a moment here to flex the foot, pressing through the heel. The knee can be as bent or as straight as you'd like it to be. And take a moment to just flex and point the foot a few times. Today's focus is going to be on the hips, but a lot of times what we feel in our hips starts at our feet, our ankles, and in our legs. Give yourself a few ankle circles here. Moving the toe in a slow circle. Keeping the rest of the leg as steady as you can and going in both directions whenever you feel ready. Know that at any point throughout this practice, if you like something, you can do it for longer than suggested. And if you don't like something, you don't have to do it at all. When you're ready, grab a strap, an old tie, a belt, the tie for your bathrobe, whatever you have on hand, and wrap it around the widest part of your foot. We're going to take a moment here just straightening the leg out as much as you can, never forcing or straining. You're going to bend your knee and then re-straighten that leg a few times. You might find that every time you straighten the leg, you're able to get it a little bit straighter, or walk the hands up the strap a little further, bringing the leg closer to your body. Staying in a range of motion here that works in your body and that feels good to you. After you do that 3 times, keep the leg straight. See if you can straighten the left leg along the ground. And whether we stay here or not, notice what you feel in that left hip flexor, the front of the left thigh and hip. If the stretch that you're getting there feels good, keep it. And if it feels uncomfortable or you're unable to straighten the leg completely, simply bring the foot back to the floor with a bent knee. Stay here for a few more breaths, noticing how you feel. Noticing what's present for you in your body. After one more round of breath, move the left arm to be level with the left shoulder and begin to open that right leg up to the side any amount, never straining again or pushing. Wherever the leg wants to stop is where you'll stop. Take a moment here, breathing deeply and fully, opening up the right hip. Again, that left leg can stay grounded, pressing firmly into the foot with a bent knee. If the leg is straight, keep that foot flexed and ground through the entire leg. Give yourself one more breath here if it's comfortable. Whenever you're ready, use your strap to slowly bring the leg back to center. Flexing the foot strongly at the top, perhaps you bend the knee one more time, straightening the leg out, looking for that deep, bright stretch in the back of the leg. Whenever you're ready, remove the strap from your foot. Keep the leg elevated and above you. Your hands can come along the side of the body or stay at shoulder height. And now you're going to draw a circle using your heel. This is going to get a little bit of rotation in the hip joint. Your circle can be as small or as big as you want it to be, but I encourage you to make the movement slow and intentional so that you can see what you're feeling in that right hip joint. Whenever you feel ready, slowly change directions. Just making a nice, slow, and controlled circle with that heel, rotating that hip gently in its socket, keeping the foot flexed and the leg as straight as you can. Whenever you feel ready, you can gently float the right leg down to the ground. If the left knee is bent, extend that leg along the ground as well and notice the difference in the two legs. Taking a deep, full breath here. When you're ready, bending the right knee, bringing the right foot to the floor, and extending the left leg up. Again, flexing that foot strongly and pressing through your heel, noticing what you feel in the back of the leg. Take some time here to flex and point the toe. Noticing what you feel in your ankle and down the back of the leg. Whenever you're ready, you can make your slow and controlled ankle circles, drawing a nice circle with the big toe, keeping the leg as steady as you can so that it's only the ankle responsible for this movement. Noticing what you feel in your foot, your ankle, and your leg. Changing directions whenever you're ready. And if you ever hear any snap, crackle, popping when you do this, know that's entirely normal. As long as it's not accompanied by pain, you're just simply working some stuff out, getting rid of some gas bubbles in the synovial fluid of your joint. Whenever you're ready, flexing the foot, keeping it up elevated, bring the strap to the widest part of your left foot. Here we're going to bend the knee again and straighten the leg. Looking for the leg to become a little bit straighter every time. Or perhaps if the leg is already straight, walking the hands further up the strap to bring the leg a little bit closer to the body. Never straining or forcing, finding whatever it is that works for you and feels good in your body. After you've done that 3 times, stay here with your leg as straight as it can, without strain. And see if you can extend that right leg along the ground. Notice what you feel in that right hip flexor, the top of that right thigh, and the front of the hip. If it's comfortable and feels good, keep it there. If it does not, bend that right knee, bringing the foot back to the ground. Staying here for just a few breaths, noticing what you feel. Maintaining that stretch in the back of the leg by keeping the left foot flexed and pressing gently through the heel, wherever your leg might be. Whenever you're ready, extend the right arm at shoulder height and begin to open the left leg out to the side. Again, only bringing the leg as far down as it needs to for you to feel a stretch in the left hip and the inner thigh. If your foot is on the ground, press firmly into the right foot. If the leg is extended, keep the foot flexed and press the leg firmly into the floor. Give yourself 2 more breaths here if it's comfortable, noticing what you feel in your body. Whenever you're ready, use your inhale and the strap to slowly lift the left leg back up. Perhaps you bend the knee 1 more time, straightening and lengthening the left leg as much as possible. Holding it here for 1 round of breath and then releasing your strap. Here we're going to draw the circle again with the heel. Keep the circle as small and let it get as large as it wants to get, keeping the leg lifted. Noticing what you feel in this left hip joint as you circle the foot slowly. Noticing that both hips might not feel the same or move quite as fluid. Whenever you're ready, you can slowly change directions, taking the time to notice the difference in the 2 directions as well. The second direction usually being the less fluid. Whenever you're ready, you can bring your leg to stillness and slowly let it drift down to the ground. If the right foot is planted on the floor, extend the right leg along the left. And notice what you feel in your legs and your hips. Just taking a few breaths here to be fully present. And if you find your mind wandering to things from the past or worries about the future, even the to-do list for later today, gently guide your mind back to what you're feeling in your body right now. Whenever you're ready, bring your feet to the floor. If you have blocks or pillows, you can make those accessible to you just in case you want them here. We're simply going to stay lying on our back for just 1 or 2 more movements. And here we're going to rest, keeping the blocks, pillows, or cushions handy in case our legs don't feel comfortable hanging on their own. So to begin, bring your feet close together. Slowly let the knees drift out to the side. The soles of your feet might come together. And here you can let the legs hang loose, going down as far as they can and allowing gravity to continue to open the hips up. If this is uncomfortable for you, simply take a block, pillow, or cushion and place it underneath the lower portion of your thigh. Here we'll stay for just a few moments, noticing what you feel. Taking this time to use your exhale to release anything that you might be holding on to. Tension in the body, tension in the mind, tension on your heart. Give yourself 2 more deep breaths here, allowing the legs to rest open, letting gravity work to open the hips and stretch the inner thighs. And now whenever you feel ready, you can slowly bring the knees back together, moving your blocks away from the side of your mat if you are using them. And now we're going to bring the knees in toward the chest any amount. Perhaps you give them a gentle hug, feeling a slight stretch in the lower back. Then take the feet up toward the ceiling and grab either behind the lower part of your thigh and knee and bringing the knees to the outside of the body, or by bringing the arms inside of the legs and grabbing onto your heels. Whatever feels best to you and is accessible, the main idea here is to bring the knees as wide along the side of the body as you can. Busting your hips open and taking a moment here in Happy Baby. You can stay here in stillness. You can rock side to side, gently massaging the muscles along your spine and in your sacrum. Or, if you're feeling particularly tight in the hamstrings, it might be helpful to straighten one leg out, bending it again to center, and then straightening the other leg out, any amount. Whatever of these 3 versions feels best in your body, that's the one to do. Breathing deeply and slowly here, noticing what you feel in your body as you move or sit in stillness. Lingering anywhere it might feel good to linger, and taking the time to notice what you feel. Finding what feels best in your body and choosing to spend time there. Give yourself a few more rounds of breath here, doing whatever it is that feels good. breathing deeply and being present. Whenever you're ready, coming to stillness if you are rocking, maybe bringing the knees back in toward the chest and hugging them once again. And then lengthening the legs along the floor or bed, wherever you are, and noticing how you feel. When you're ready, we're going to roll onto our side. You can bring your bicep under your head for support or use a pillow. You're going to need a block, a cushion, or a pillow here as well for in between the legs. And you're going to place that prop in between the knees. Here what we're going to do is a little bit of internal rotation on the hip. So with the top leg, whichever leg is on top, lift the heel up, squeezing the knee with your block, and you can keep your foot flexed so that the ankle joint's not moving. Only the hip. The knees are bent, the feet are flexed, and you're simply rotating the hip internally here, noticing what you feel. Maybe giving yourself 2 more here on this side. Noticing what you feel in the outer glute as well as the hip and thigh. Whenever you're ready, you can roll back onto your back and onto the other side. I'm going to just switch around so that you can still see me. Again, bringing the bicep or a pillow under the head for support. Bringing your pillow, cushion, or block between your bent knees. Flexing the other foot now that's on top. And lifting that foot. Keeping the block squoze in between the knees. Just internally rotating the other hip now. Notice what muscles are being activated in this movement and the way that they respond to that activation. Give yourself 1 more here. Noticing what you feel. And then you can gently remove the block from in between the knees. Now we're going to roll onto the belly. And here you can have your forehead resting on a pillow or on the floor. And then you can bring one leg out to the side so that the knee is maybe even with the hip. Here we just want to create a little bit of openness in the hip with the bent knee. And you can stay here for a few rounds of breath. If it feels good, keep the other foot with the extended leg, the top of the foot pressed firmly into the floor or bed. Perhaps you choose to bring the hands under the shoulders. Without putting too much weight in the hands, perhaps you choose to inhale and lift your sternum up any amount. As you exhale, you can lower yourself back down. And do that 2 more times if it feels good. Inhaling, lifting the sternum, keeping the glutes squeezed. Exhaling, lowering back down. One last time, if you want, inhaling and lifting. And exhaling to lower back down. Whenever you're ready, you can bring that left leg or that outside leg behind you. And then we're going to bring the other knee up toward the hip. I'll switch sides so that you can see again. You can stay right where you are. And here again, the head can rest, the forehead can rest on a pillow or the bed or the floor. You'll bend the knee and bring it up towards your hip with a flexed foot. And you can stay right here. Or if you want, with light hands under shoulders, inhale up, finding a gentle back bend, a little bit more openness in that hip, and exhaling slowly back down. Giving yourself 2 more just like that, inhaling up. And exhaling down. If it feels good, give yourself 1 more. Coming back to rest and bringing that bent knee extended along the floor next to the other. Taking a moment here to see how you feel. When you're ready, we're going to push into our hands and bring ourselves onto our hands and knees. Your hands directly under your shoulders and your knees directly under your hips. Here we're going to do a few CARs, controlled articulated rotations. To do this is simple. It's also possible to do this lying on your side or standing up. For now, we'll demonstrate it on all fours. If your wrists bother you here, you can place a rolled up towel or blanket beneath the heel of your hand, or you can make fists, taking the bend out of the wrist completely. Wherever your hands are, when you're ready, take the right foot and bring it out to the side, creating a little bit of that internal rotation. Here, you're going to lean the hips back and just rock a couple of times. When you're ready, press into those right toes and lift the knee up. The toes will point out away from your body, and you'll rock here again. Keeping the back straight, your breath full and easy. Simply opening up that hip with some gentle rocking and external rotation. Whenever you're ready and you feel complete there, you can lower the knee back to the ground. Bring the right foot back into alignment. And now with the same thing on the left side. Taking the left foot out, I'll demonstrate it from the back. Taking the left foot out to the side. Just rock a couple of times here. Notice what that internal rotation feels like. When you're ready, digging into the left toes and lifting the knee off the ground so the foot and knee point away from the body. When you're ready, rocking a few times here. Going as deep or keeping the movement as shallow as feels good in your body. Back long, breath full and easy. Notice what you're feeling in your hip with this external rotation and gentle movement. Whenever you're ready, you can drop the knee back and bring the foot back into center. Notice what you're feeling. Next, we're going to lift the knee up, and these are the CARs. Out to the side as if you were a dog getting ready to pee on a hydrant, and then turn the knee down, lifting the heel to the ceiling and bringing the knee back under. That makes one full rotation. Lifting out to the side, turning the foot to the ceiling, and lowering the knee back down. If it's comfortable, give yourself 3 more here at your own pace. Noticing what you feel in the hip and the glute as you make these controlled, articulated rotations. Whenever you finish your last one, bringing the knee back to center. And when you're ready, moving to the other side. You can stay right where you are. I'm flipping just so you still have a visual. Inhaling, lifting the knee out to the side, flipping the foot up toward the ceiling, and bringing the knee back underneath. Noticing the difference in the two hips, in their range of motion and mobility, and also in what you feel muscularly here. Both hips are likely not the same, and that's okay. Give yourself 2 more here if it's comfortable, noticing what you feel, what muscles are engaged. As you lift the knee out to the side, flip the foot up toward the ceiling, and lower the knee back down. Whenever you're ready, you can come just to a seated position. Notice what you're feeling in the hips. And I'll demonstrate how that looks lying on your side as well. Going in the other direction this time. So if you'd like, lie back on your side with your bicep or your pillow underneath the head for support. Bring your knees. Your legs can be straight, your knees and ankles stacked on top of each other, flexing the feet. Kick the top foot behind you. Spread the knee out wide, and then bring the knee out front. Driving that foot behind you again. Lifting the knee to open the thigh, open the hip, and slowly circle the knee out front. Bringing the foot out back, opening the hip, circling the knee to the front of the body. 2 more times, bringing the foot to the back, lifting and opening the hip, circling the knee to the front. 1 last one. Foot comes to the back, knee comes out as wide as it can, circling it to the front. And you might feel or notice an entirely different set of muscles or intensity of engagement when going in that second direction, because it's a direction, a range of motion that we don't often use in the hip. When you're ready, you can flip to the other side simply by rolling over. Again, bringing the head to rest on bicep or pillow, the legs straight on top of one another, stacking knees and ankles, flexing your feet. When you're ready, bend the knee and bring the foot behind you. Lift the top knee or hip. Bring that knee to the front, and then drive that foot to the back again. Lifting and opening the hip. Circling the knee to the front of the body, and bringing the foot to the back. Giving yourself 3 more here if it's comfortable. Noticing what you feel, the difference in the 2 directions, the difference in the 2 hips, and taking note of which one of these you like better, on all fours from tabletop or lying on your side. 1 last one. And then just simply lengthen both legs on top of one another, noticing how you feel. And whenever you're ready, taking your time, slowly coming to a seated position. Here we're going to spread our legs as wide as we comfortably can. You don't have to bust a middle split. Your legs can be closer together or further apart. Find what feels good in your body, but you do want to feel a slight stretch on the inner thighs. Here we're going to make the spine nice and tall, shoulders directly over the hips. So take a moment and see or sense where is your upper body in relation to your pelvis. We might have a tendency to lean forward, or depending on the anatomy, to lean back. Try to bring yourself into a straight line from hip to shoulder, using the muscles along the rib cage and in your belly to help support you. So a little bit of deep core work here. When you're ready, getting as tall as you possibly can, flexing your feet and pressing the back of the legs into the floor, begin walking the hands out any amount. And you might only come out an inch or so. If you feel an intense stretch on the inner thigh, that's exactly where you want to be. Hold that here for a few rounds of breath. If you can go further, but do not push or strain. Find the stretch that works in your body today. Lengthening the spine. Remembering that the key is not to bring the head or the shoulders to the floor. The key is to try and bring the top of the belly closer to the thighs and pelvis. So wherever you are and wherever you're getting your stretch, it's perfect. Give yourself 2 more deep, full breaths here, noticing how you feel. Whenever you're ready, wherever you are, begin walking the hands back towards your body with a long spine. And then take the left leg and bend the knee. Bring that knee in as close to you as you can with the toes still pointing out slightly. Keep the right foot flexed and the leg straight. If you need to or like to, you can bring the right arm behind you to help you lengthen the spine. Hang here for just a moment and bring the left arm to the inside of that left leg. Gently press the arm into the leg, coaxing the hip open, and perhaps you look over toward the right, maybe even toward the back right shoulder. Giving yourself just a few rounds of breath here. Feeling that openness in the left hip. When you're ready, you can inhale and come back to center. Lengthen the left leg along the ground and bring the right foot to the floor now. Bringing that knee as close to you as your body will let it, knowing that the hip flexor and the tightness in that will be a big determining factor in whether or not the foot stays here or it comes in close. No judgment, just compassionate curiosity as you get to know your body. You can bring the left hand behind you if you like, helping to keep the spine nice and tall and straight. Keeping the left foot flexed and the left leg grounded. Bring the right arm to the inside of the right thigh and gently press open. You can begin to look over to the left if that's comfortable, maybe looking back toward the left shoulder. Holding this for a few rounds of breath, noticing what you feel in that right hip. Give yourself 1 more round of breath. And on your next inhale, slowly come back to center. Lengthen the leg along the ground. And bring your legs together. Keeping the back nice and tall and the feet flexed. Bend the right leg and see if you can bring the heel close to the body. It might be out here, still creating internal rotation. Wherever you can bring the foot, we want to create a little bit of internal rotation in that hip. Make yourself straight, stay grounded through your extended leg, and notice what you feel. Remembering that if anything is ever painful, you should immediately and tenderly come out of it without judgment, simply honoring where your body is at. Whenever you're ready, you can slowly and carefully extend that right leg next to the left, perhaps taking a second to notice the difference in the hips, and then bringing the left knee to bend. Again, only bending it as far as it wants to go. Perhaps the foot is out almost at a 90-degree angle. Perhaps the foot is able to come a little bit closer to the body. Wherever your leg wants to go is perfect. Either way, you're creating that internal rotation in the hip. Taking a moment here. Breathing deeply and fully. Whenever you're ready, you can extend the left leg slowly next to the right. And then bringing the hands behind you to help support a nice long spine. Bring your feet to the floor wide, perhaps a little bit wider than your mat. And here we're going to begin to just drop the knees to one side and then the other, just like some windshield wipers. Don't force the knees toward the ground. If they reach there, great. And if they don't, also great. Here you might feel a gentle massage and opening in the hips, as well as a gentle massage at the base of the spine and in the sacrum. Continue breathing deeply and fully, noticing what you're feeling in your body. This creates both internal and external rotation, alternating from side to side. You can stay right here for the next few rounds of breath. If you want a little bit more action as you turn the hips toward the left, you can reach with the right hand and gently twist your body. Coming back to center if you choose. As the knees drop to the right, you can reach with the left arm. Again, just a gentle twist. A little bit more of an intense stretch in the outer glute and hip. Whichever version you're doing, give yourself just a couple more rounds of breath, perhaps one on each side. And then coming back to stillness. Noticing what you feel in your hips. The next move is going to be a little bit of strengthening. With your hands behind you to promote that long, tall spine. Extend one leg out in front of you, and using your hip, begin to turn your leg. Pointing the toes in and out, not using the toes, the ankle, or the knee, but the hip joint to make this happen. Within a couple of these, your quad will be screaming at you, your outer hip and glute might be tired, and you can gently let that leg rest. Extending the other leg now, turning the toes in and out from the hip, using the hip joint to make this happen. Again, noticing when the leg starts to get tired, honoring that and knowing that it might not be the same on both sides. Whenever you've had enough, you can gently drop the leg to the ground and notice what you're feeling. When you're ready, bend both knees, bringing the feet to touch one another. Here's another spot that you could use blocks, pillows, or cushions. If the legs don't want to drop down to the ground and let gravity pull on them, if it's overly uncomfortable or you feel a strain, simply bring the blocks, pillow, or cushion to the lower portion of your outer thigh. Keep the back nice and tall. You can hold on to your feet, lengthening the spine and engaging your core here, doing whatever feels good and allowing the legs to rest open. Keeping the mind focused in this moment on your body, what it's feeling, and on the calm, steady pace of your breath. When you're ready, you can bring the knees together, extend them out, the legs out in front of you, and move your blocks. For the next bit, we're going to find ourselves next to a wall. So if you can get next to a wall, wherever it might be, bring your hip to touch the wall. You want to get as close to the wall as you can here because it'll make the next bit a lot easier. Here you're going to begin to turn your body away from the wall, bringing the legs up along it. Ideally, you want your backside, the back of your legs, and your heels to be touching the wall. We're just going to stay here, and you can stay here for anywhere from 10 to 20 minutes. You can do this every day, helping to improve lymphatic drainage, improve your circulation, open up the back of the legs, including the hamstrings, especially if you're flexing the feet here. It'll also help take pressure off the lower back and in the hips. It's also good for mild depression and a bunch of other things. We're going to stay here for a few moments. And if you want to, there's the option to spread the legs wide, only as wide as you want them to go and feel comfortable with. You'll feel a slight stretch on the inner thighs. I wouldn't hold the wide legs for longer than 5 or 6 minutes. And whenever you are done holding the legs up the wall, especially if they're wide, you can use your hands to help guide them back together. So wherever you are, simply breathe deeply and fully, noticing what you feel in your body. As you're here, try to keep the mind from wandering to worries of the past, concerns about the future, the to-dos of later today. Try to stay focused on this moment. Perhaps taking this time to be grateful for your body, for all of the bullshit that it put up with, for everything that it does for you and is still going to do. Spending this time to cultivate a more intimate relationship with your body, getting to know what it needs, what feels good in it, and allowing yourself the opportunity to provide that. This session has been a somatic exercise, getting you focused on your body and how it feels. I hope you enjoyed it. If you're looking for more strengthening work, there will be more videos coming soon. Stay here for another 10 minutes or so if you can. Enjoy yourself and have a great fucking day, fam.